Ready?
Yes, sir.
Most time 11th.
Yes, sir.
Soon you will get degree. After that you will get degree.
Yes, sir.
After 12th sem you will have, when all final semesters will be over, you will have state exam, which consists of 3 steps. MCQ, after the practical, third is Viva. 3 questions, 1 case, John take your degree, see you, bye bye. Yes. If we are talking about practical exam in obstetrics and gynecology, mostly there will be 3 steps. First is history of the patient, second is vaginal examination, third is external obstetric examination. Did you discuss with your teachers previously about external abdominal examination in third trimester of pregnancy? No.
Only one class.
From the semester we don't have much class.
But you pass model exam.
How you pass exam?
I don't know. Ask me.
Depends on your questions.
Exam was not about
क्या learn we got by heart.
In other parts of your body.
Yes.
Yes, ma'am.
Visible?
Yes.
First of all, if we are talking about full examination, of course, in your exam will be short case. Let's talk about full examination.
Yes.
Pregnancy, lady is pregnant, she is in third trimester of pregnancy, she came for standard medical checkup. First of all, we should make our visual inspection, yeah? When we are making our visual inspection, we can see some abnormalities, color of skin, color of scleras, for example, yeah? Mood of the lady, etc. With what we can see average age, height, and the weight of the patient. But we should start from the vitals. Vitals means BP, pulse rate, body temperature. Why we should check BP in third trimester of pregnancy? It can lead to different gestational Okay. We should check the BP. BP should be checked on what hours. For example, our patient's BP is normal, 110/70, mmHg, pulse rate is normal, body temperature is normal. After this, we should check height and weight of the patient. Why? Why we should check height and weight?
Baby growth.
So,
weight of the baby.
Sir, to calculate blood during
body mass index.
Sir, by height and weight we can calculate blood, sir, which can we can be prepared for blood loss during pregnancy or delivery.
If we will calculate BMI for us, accuracy will be high. But in pregnancy, in third trimester, in the end of pregnancy, accuracy will be low because lady has physiological weight gain, which is approximately 15 to 18 kg. Matlab, if she was 50, closer to delivery, her weight will be approximately 65 to 70. We need to know height because we can provide different types of surgeries, and sometimes spinal incision will be used. At that situation, anesthesiologist should know height of the patient. For us, for example, if we are gynecologists right now, we should know weight of the patient. Why? Because according weight of the patient, we can calculate amount of the blood. According formula which is using in India and Pakistan, you are using 80%. For example, your weight is 50 kg, we will increase on 80, finally 4000 ml is approximate amount of the blood. If your weight is 60 will be increased on 80%, 4800 ml is approximate amount of the blood. That's why by this calculation we can know exact approximate amount of the blood which is in your body. Why? More weight, more tissue. More tissue, more oxygen, more nutrition. That's why more blood. Yeah? Why we should know about it? Because according to WHO classification, normal blood loss in vaginal delivery is still to 500 ml. In C-section, 1000 ml. But look guys, it's written for standard patient. Who is standard right now, right here? No one, huh? Except me, huh? Okay. If we are talking about different cases, she can be tall European lady. More body mass, more amount of blood. That's why she can compensate 1000 ml of blood loss normally. But if she is from Asian country, it will be difficult. Her weight is less. Huh? If your weight is less, for example, she has weight 50 kg, but she has blood loss 1000 ml, finally she lost 25%. Hemorrhagic shock will be started from 30%. Yes, according to WHO, you write that blood loss was normal, but according classification of blood loss by percentage, she has pathological condition. First class of blood loss according percentage from 0 to 15. Second class from 15 to 30%. Third from 30 to 40 when hemorrhagic shock will be started. And last is more than 40%. Okay? That's why we should use this classification to our blood loss. Did you understand? Vitals, height and weight of the patient. After that, we should start our specific physical examination. Lady should be located in horizontal position. Which is position right now?
Fine.
Yes. But during pregnancy, especially in third trimester of pregnancy, it's not good. Why? Because it will compress when the blood supply. That's why if you will decrease, she will feel hypoxia, and even she can become unconscious. That's why we have short time, limited time for our physical examination. What we should do? Totally in medicine, examination consists of auscultation, percussion, palpation. Percussion in obstetrics is not using. In medicine, mostly you are using auscultation and after that palpation. In obstetrics and gynecology, it's opposite. First of all, we should palpate and after that auscultate. Sex especially, palpate. What we should do? Lady is in this position, we should be located face to face. We are using 4 Leopold maneuvers or 4 Leopold tricks, 4 steps. By this step, we should know exact position of the fetus because we are planning she will have vaginal delivery or cesarean section. C-section or delivery, not free home delivery from Amazon, but okay? What we should do? Baby is not visible for us. Baby is inside of the uterus, but in Bachardani, yes. What we should do? By first step, we should find height of the fundus. We will put both our hands and we will try to find height of the fundus. Height of the fundus depends on location of fetus. For example, I will palpate, boom, height of the fundus is here. Let's do it. Baby is here. I will palpate. This is end of the fundus. That is height of the fundus. Why we should know height of the fundus? Because previously from history I asked date of last menstruation. According date of last menstruation, I can calculate gestational age. And I will check according gestational age height is normal or not. It can be less when fetus is a small size, hypotrophy, have deficiency of nutrition, or oligohydramnios when amniotic recruits are less than normal. Or look at this. If baby it's ideal position, if baby will be in transverse position. For example, that's why height will be less. In some cases, height can be more than normal. In case of polyhydramnios, microsomia, large size fetus diabetically lady, manazbacha, or in case of multiple pregnancy, dobache in Karvashi. Okay, did you understand? Yes. First step is height of the fundus. Second step, I will check position of the fetus. Position of fetus depends on back of the fetus. Baby inside of the uterus can have longitudinal position when spinal column of fetus and lady are on same line. Longitudinal position can be cephalic or buttock. Baby can have transverse position. This angle is 90 degrees. Baby can have oblique position between spinal column of fetus and lady. Angle is less than 90 degrees. Oblique position can be cephalic or can be like this. Finally, longitudinal, transverse or horizontal, and oblique. Baby can have anterior position, front view. Depends on location of back. Baby can have posterior position, back view. Uske baad, left side position, right side position. First or second. You can tell left side, right side. It's more than enough. Longitudinal, transverse, oblique, front view, back view, left side position, right side position. Again, first step, height of the fundus. Second, position of the fetus. Third step, I should check presenting part of fetus. Presenting part of fetus is part which is located near the pelvis. It means that by this part, baby will start to lift the uterine cavity. Baby will be delivered by this part. From previous steps, I know that baby has longitudinal position. That's why here I have just only 2 scenarios. Here should be head or buttock of the fetus. If I will palpate, here is hard part. Hard means head. Soft means buttock. No? You can palpate each other. It means that buttock will be here. No? 3 steps are completed. Again, height of the fundus, position of baby, presenting part. After that, previously I was located face to face patient. I should turn on my body on 180 degrees. Why? Because I need to check location of presenting part according to pelvic canal. Pelvic canal, as you remember, consists of 3 parts, which are inlet, cavity, and outlet. Inlet is entering part, cavity is narrow part, outlet is exiting. What we should do? By 2 hands, I will fix fetal head and I will try to move. Movement is possible when fetal head is upper than inlet. When it will be inserted in inlet, movement is limited, approximately 1 to 2 centimeters. In which situation fetal head is upper than inlet? When gestational age less than 34-35 week. Closer to 34-35 week will be releasing of prostaglandins. That's why lower segment of uterus will become soft. Cervix will be dilated a little bit. That's why mucus plug, which was located inside of the cervix, can start to come outside. Lady can complain about mucosal discharge. At that time, also this lady will tell that I can breathe properly. Why? Because diaphragm, which was compressed, now is relaxed. Because fetal head will be inserted in inlet. Height of the fundus will become lower, and she can breathe properly. These two symptoms means that thoracic uterus is preparing for vaginal delivery, and fetal head came in inlet. Very good sign, no, for us. Okay. You understand, guys? In some cases, fetal head can be upper than inlet even in term age, when it's more than 37 gestational weeks. Why? Baby has hydrocephalic condition, totally large size fetus, or polyhydramnios, when amniotic fluids are more than normal. Baby can't fix because fluids are more than normal. Or lady has narrow pelvis. In that situation, if pelvis is narrow, baby can't be inserted in narrow inlet of the pelvic. Okay? Did you understand? 4 steps. Again, height of the fundus, position of baby, presenting